she got a stress test. The stress test used a radioactive dye, and that dye was traced by a CT scanner. Now the cost for this procedure was $8,000. So we're eating into that. You can begin to see why at the end of the day she's got a $21,000 bill. So $8,000 for a stress test. Medicare would have reimbursed the stress test for $554. So you get the idea. Now I'd like to also mention, just throw in my favorite overcharge of all the charges, and this is a 26,000 word essay that Steve Brill wrote. I mean, there are just numerous examples that he gives, but I just like to mention my favorite of all of them. An individual went into the hospital, and among the many services and tests and things that he was provided, he needed niacin, vitamin B3. Now, vitamin B3 is just a standard B vitamin, can be found at CVS or bought on Amazon for 5 cents. Now, so if you think of a pill of niacin, 500 milligram, costing 5 cents, what do you think the hospital would charge for it? Would they jack up the rate by 100%, charge a dime? Or maybe the pricing would be really aggressive, and they would increase the price by a factor of 20, charge $1 for it. Does that sound like in line with what I've been talking about? In this case, if you look at the bill, for each niacin pill that this patient was given, they were charged $24. So in other words, they charged that individual 480 times the drugstore value of this medication or of this vitamin pill. Now, I mean, that shocks the conscience that they could do this. I mean, it is unimaginable to me. And obviously, he could have brought a bottle of vitamin B3 in with him, and because they gave him 19 pills to the tune of $456 on his bill, he could have brought a bottle in with him and saved $450. I mean, this is just extraordinary. So I think you get the idea. And I'm not going to bore you with any more examples of abusive, predatory hospital pricing. What are my takeaways from this? What lessons are there to be learned from Steve Brill's article? Well, first of all, we need to rethink the whole idea of a nonprofit tax status. Each of the hospitals that I've talked about has a nonprofit status. And what that means legally is that they have to provide a service to the community, which they certainly do, and they have to have no shareholders to whom they're distributing profits at the end of the day. So provide a service and not have shareholders, and that gives you a nonprofit status where you don't have to pay any federal taxes. But the term nonprofit in the public mind suggests a benign organization that's operating close to the bone, is operating in a charitable fashion, etc. How can you possibly consider yourself a nonprofit when you're charging 480 times what something actually costs if you were to buy it at the drugstore? And why should these nonprofits, who at the end of the day make as much money as so-called for-profit hospitals, I mean, at the end of the day, they're both identical in how aggressively they seek profits. Why should they be permitted to have a tax-exempt status? It makes no sense to me whatsoever. Second of all, even though one has to be outraged and disappointed at the hospitals, one also has to be a bit disappointed with the Obama administration, because I have to believe that the panel of experts who consulted with the administration and whose expertise went into the formulation of the Affordable Care Act, they must know about these abusive predatory pricing schemes. Anybody that follows the health care industry closely must know that this has been going on for years. And not only did they ignore it, but basically there was no discussion of this whatsoever during the healthcare debate. It was all about who's going to pay. Who's going to pay the bill? Not why is the bill as swollen and inflated as it is. And my explanation for why they ignored this is the following. The administration needed an ally during those very difficult negotiations of the healthcare reform bill. And they found an ally in the hospitals because, after all, the hospitals knew that they would get an enormous windfall out of this. That windfall being 30 to 40 million new patients coming into the marketplace that would obviously benefit the hospitals. So the hospitals were very receptive to this idea of healthcare reform. And I think the administration must have recognized that if we go after the hospitals for their predatory pricing schemes, we're going to lose them as an ally. So let's overlook that part and simply get to the issue of how we're going to reformulate insurance and who's going to pay and so forth. Well, you can't overlook it. If you want to bend the cost curve, you have to look at these excesses that Steve Brill has brought to light. The third third takeaway from this is we have a system where those with least pay the most, those with most pay the least. We also have a hospital system that has no transparency. You can't call up a hospital and say, I'm coming in to have my disc replaced. What's it going to cost? Because they will give you runaround. Whereas you can go to Medicare and clearly be told what the price is of a procedure that you're going to get. So there has to be transparency. Second of all, how can we not be regulating the hospital industry? I mean, this is a vital service that everybody needs. If the utility industry were overcharging in the same manner, we'd all be going crazy. That's because by custom, we're used to the utilities being regulated. We're not used to hospitals being regulated, but they should be, obviously. Finally, what Steve Brill found was the most efficient manager of healthcare costs in the system was Medicare. We hear lots of discussion these days about the idea of raising the Medicare eligibility age from 65 to 66 to 67 under the assumption that that would save money. Steve Brill reaches the exact opposite conclusion, that what we really need to do is lower the Medicare age, because Medicare is the most efficient element in the healthcare system today. So if we had a single payer system that was Medicare for all, we would have a far less inflated cost structure than we currently have in the private market. Now that may be politically impossible, but in terms of the evidence that he's brought to bear from his examples, that's certainly something to be considered. So this was a real eye-opener for me. I knew that healthcare costs and hospital pricing was probably inflated, but to this extent, I really had no idea. And so I hope that Congress picks up the ball on this. And I guess my final question would be, Elizabeth Warren, Senator Warren of Massachusetts, where are you when we need you? I hope she's read this article. I'm Jeff Rowan. I'll talk to you next time.